So welcome to this ENETS Congress in Krakow. I'm here with Jaume from Barcelona to share our impression about the highlights of this first day in this important Congress on neuroendocrine tumors, and we are about 1,000 attendees. So it is a great number of colleagues. What do you think?
As usual, ENETS is joining the most important and most relevant attendees and physicians treating NETs in almost the world. We are here today, again to review these highlights, to review which were the most interesting presentations done yesterday, today also on Thursday, and we will repeat that tomorrow on Friday.
Aye.
So, Chiara, for you, yesterday we had a very complete program with probably clinical and translational interesting talks. For you, which were the most interesting topics addressed yesterday?
So I think that there were many interesting topics, and in fact I have a list in my book. And I think that we started with a keynote lecture about the metabolic resistance to anti-angiogenic therapy, and it is a very important topic. Then I think that the knowledge, the finding of the primitive tumor in neuroendocrine tumors, it has been a very important discussion. And two more important topics for our work that has been the management and the basic research about mesenteric fibrosis, that it is an issue for surgeons, nuclear physicians. And the other topic has been about the management of carcinoid syndrome with all the characteristics and with all the therapies. I think that these were the most important topics of yesterday. And about this morning, we had some very important news about some clinical trials. Could you tell us something?
Sure, Chiara. So this year at ENETS we have been lucky that we have the reports of two prospective randomized studies with a radiopharmaceutical compared with a targeted agent. So the first study reported by Rick Baudin is the OCLURANDOM French study. So there the French people compared the radiopharmaceutical with sunitinib in heavily pretreated patients with G1 and G2 pancreatic NETs. Well, we know that this is a small study, academic study, and phase 2.
Yes.
But it's probably one of the new and the most initial data comparing targeted therapy and a radiopharmaceutical in heavily pretreated pancreatic neuroendocrine tumor patients. And the second presentation, as you well know, I'm happy that I had the honor to present for the first time the results of the COMPETE trial. As you may know, the COMPETE is the first international phase 3 study that compared a radiopharmaceutical versus everolimus in G1 and G2 gastroenteric and also pancreatic neuroendocrine tumors, grade 1 and grade 2. So today, here just a few minutes ago, we presented the initial results. And the initial results means the primary endpoint of the study, that this is the progression-free survival. This progression-free survival has been evaluated by a central radiology assessment. And this is a clearly positive study. So the lutetium metotrexate here increased significantly the progression-free survival to almost 2 years of median PFS.
Very high.
Compared with 14 months with everolimus. So this is the real first phase 3 study comparing a radiopharmaceutical and a targeted therapy in G1, G2, grade 1, grade 2, gastroenteric and pancreatic NETs, in first and in second line. So I have no doubts that the results of the COMPETE study will change the guidelines in the near future.
Yes, I completely agree with you. And so I think that now we are approaching to the next sessions. And so what can we say to our colleagues? Yes.
So maybe the main thing here is saying that tomorrow we will be here again. So we will try to do the highlights of this evening and tomorrow morning. We invite you to come here again, not to
Yeah.
listen us, and we will try to review quickly what will be presented today and tomorrow.
Okay. Thank you, June. Thank you.
So thank you for listening us, and see you tomorrow.
See you tomorrow. Bye-bye.